Welcome if you're new here, and welcome back if you've been here before. My name is Dr. Lucy of the Eye Clinic channel, and in this channel we teach you about eye diseases and eye conditions and where you can get some help. We also tell you some of the things you can do in the comfort of your home to sort out some minor eye difficulties. So be sure to subscribe so that we can let you know when we do upload our videos, and we do this every week. Welcome to 2021, a new year, a new beginning, new normals. We wish you a very wonderful, healthy year. We will be continuing with our educative videos, and in this series, we continue with the diabetic series. So if you've not already watched the other videos, we will put a link below so that you can go and check them out. Over 3.3% of Kenyans, that's about 1.5 million Kenyans, and over 400 million people globally have diabetes. That is huge. That means all of these people are potentially at risk for getting diabetic complications. And these numbers continuously increasing day by day. So today we're going to discuss some of the diet that will help to prevent diabetes, and also a diet plan for those who are already diabetic. So to help us do this, we have Lina Njoroge, who is a consultant nutritionist and for many years has been in this field. So welcome, Lina Njoroge.
Thank you, Dr. Lucy, for inviting me to this show. I am glad to be part of this educative program on eye care. My name is Lina Njoroge, and I'm a nutritionist consultant, and I run a wellness and nutrition clinic. I will put a link below so that you can be able to check out on the different programs that we have. So today I will be discussing diet specifically to help the diabetes maintain sugar levels at an acceptable level, and how a healthy balanced diet helps protect your eyes. Remember, high sugar levels is what causes all the damage that occurs in diabetes and can cause blindness and failure of vital organs like the heart, the kidneys, and of course the eyes. By just practicing good nutrition, you can prevent all the damage from diabetes. So let's get started. Food as we know it is divided into three major food groups, which provide all nutrients our body requires, including vitamins, minerals, fiber, and of course there's water, which we all need. So I'll be expounding more on the different food categories, which are mainly proteins, carbohydrates, and fats. In some instances, it is actually possible to manage diabetes by diet alone. I will also explain some of the terms that you may hear, like glycemic index relating to food and BMI, so that you can be able to monitor your progress. The first group that I will discuss is carbohydrates. We get carbohydrates from vegetables, fruits, plant protein, and a person with diabetes needs carbohydrates as well, because carbohydrate is broken down into glucose, and that is what gives us energy. Now, for a diabetic person, it's too much glucose in the blood that is not good. And how can we eat healthy and prevent too much glucose from the body? Carbohydrates is categorized into two. There's what we call complex carbohydrates and simple carbohydrates. Now, complex carbohydrates are carbohydrates that are not refined, and these come from the natural food in its most natural form. Simple sugars come from foods that have been refined. For example, bread, like white bread, maize flour, white wheat flour. That's why we usually tell diabetic people with diabetes not to eat white bread, rather they eat wholemeal bread because it has more fiber. Now, foods that are refined, or carbohydrates that are refined, do not have fiber. And fiber is very important in managing diabetes, because fiber is able to lower down the blood glucose levels. And so one of the things that we say is that you don't have to avoid carbohydrates entirely, because carbohydrates, remember, come from vegetables, they come from fruits, they come from the different plant proteins and starches. What you need to actually avoid is refined carbohydrates, or what we call simple sugars. And this is the reason why. Now, when you take refined carbohydrates like white bread, white porridge, what happens is that the blood glucose levels increase significantly. It's like taking glucose. And that's why the word glycemic index comes from. Glycemic index is when we measure how fast food is absorbed in the body, and we measure the absorption against glucose. Remember when a person faints, maybe because they've not eaten, what do we give them? Glucose, because it goes straight into the bloodstream. It's already broken down. But when you eat carbohydrates, it has to go through digestion and it has to be assimilated, and then the blood sugar levels are released. So when you eat foods that are high in carbohydrates, or rather they're high in fiber, then the blood sugar levels or the glucose levels are released very slowly. So you don't have a spike in blood glucose levels. And so that's why we talk about eating foods that are low in glycemic index. And foods that are low in glycemic index are most foods that are not highly processed. The other category I'll talk about is fats and oils. And there are two sources of fats and oils. There's animal source and there's plant source. And we always say that choose plant-based oils or fats, because the animal source is saturated and it's one of the causes of clogged arteries, which can bring complications for people living with diabetes. But yet, even in plant based oils and fats, avoid those that are hard at room temperature, because they have they also contribute the same way as cholesterol. They clog the arteries. They have trans fats, and these are not good for the arteries and the vessels in the body. And again, it's about moderation. These are the group of foods that we say you eat in moderation. Too much oil can actually increase the body's own cholesterol levels, and this can lead to complications. The other important category of food is fiber. Fiber is good for diabetes management because it helps to lower blood glucose levels, and it also helps to lower cholesterol levels. And where do we get fiber from? We get fiber from vegetables, we get fiber from fruits, we get fiber from plant-based proteins. Meats, oils do not have fiber, and that's why we need to have those in moderation. Now, fiber should be your friend. So eat lots of vegetables, that especially the green leafy vegetables that are very high in fiber. Of course, there are other vegetables that are starchy, so eat those ones in moderation, because remember, if they have starch and carbohydrates, then if you eat too much of those, then the blood glucose levels will increase. All your meals at least should have vegetables, and that's why we talk about complex carbohydrates, because of the fiber. That's the reason we also talk about eating wholemeal versus white. For example, eat wholemeal bread versus white bread. Take wholemeal porridge like oats or wimbi porridge instead of white porridge. Eat chapatis that are made with wholemeal flour rather than the white flour, because of the fiber content, which is good for management of diabetes. Now, of course, don't forget water. Water is good for us because, of course, it helps to eliminate all the unwanted toxins from the body. And if you want to know that you're not drinking enough water, look at your urine after you use the toilet. If it's dark in color, then you're not hydrated well. So you need to drink plenty of water. An adult can take up to 2 to 3 liters of water a day, and take it, to your preference. You can take it warm, you can take it cold, but avoid extreme cold water or extreme hot water, and drink water throughout the day. And remember, do not rely on feeling thirsty to drink water. Just know that you need to do 2 or 3 liters of water a day. And of course, if you're physically active and it's very hot, you can drink more water. In summary, what you need to remember is that exposure to elevated blood glucose levels over time increases your risk of developing diabetes complications, especially related to eye. To reduce the risk of severity of eye disease, keep your blood glucose levels within the normal ranges, and this can be achieved by adopting a healthy lifestyle. What is a healthy lifestyle? That means that you need to exercise every day at least 30 to 45 minutes. This exercise actually lowers blood glucose levels. Exercise lowers cholesterol levels. Exercise lowers blood pressure, high blood pressure, and exercise will maintain your weight. And eating a balanced diet, and of course going for your regular checkup. Now, why is it important to exercise and eat a healthy diet? It's because it will help you maintain your weight. How do you know if you're overweight or if you're underweight? It's by taking your weight and your height, and then we calculate what we call the body mass index. And the body mass index is a classification of weight in relation to your height. And so a good body mass index is between 18.5 to 24.9, and this is universal. And so it's important to do your all your parameters, your weight, your height, and other assessment to be able to maintain a good weight. And when you have a good weight, then you're able to control your blood glucose levels well, and this is important for diabetes. The other thing is that you need to aim to target levels of your blood glucose levels and your blood pressure and your cholesterol. To get more information on the topic and how to measure your BMI and on various diet plans and a comprehensive body analysis, please check the link in the description.
Thank you, Lena, for that elaborate discussion on diet, particularly on diet in diabetics. We'll certainly be inviting you to talk more on nutrition. And thank you for listening. For more on eye care matters, do subscribe to this channel by clicking on the subscribe button. Until next week, I'll see you then.